Welcome to Health Bites. Thank you everyone for joining us. It is my pleasure to introduce our guest speaker, Brenda Linares. Brenda currently works at the University of Kansas Medical Center Dykes Library as the School of Nursing Librarian. She's been a medical librarian for 14 years. She has also received grants to collaborate and work on outreach projects to promote patient and consumer health education resources. She's worked with diverse populations promoting health literacy and consumer health education. She was a co-PI, principal investigator, in an outreach project with the director of Juntos Center for Advancing Latino Health to promote credible health information. The project involves partnering with Spanish-speaking professionals to record Spanish podcasts on health topics relevant to the Latinx community. In today's Health Bites, she will give a presentation on the use of podcasts to reduce misinformation in the time of COVID-19. A collaboration of librarians, healthcare providers, and community organizations. Thank you, Brenda, for being our guest speaker this morning, and I will turn everything over to you.
Hi, thank you so much for having me. I see some familiar names in the attendees, so I just want to say hi and a shout out to all of you. I know many of you, and thanks for attending this presentation. Let me start sharing my screen, and we'll go from there. And if I can get a little nod to see if you can see my presentation, or yes, and yes, that way I know that you're seeing it.
Working perfectly, thank you.
Awesome. Well, I have two monitors, so that's why you're probably going to see me looking back and forth. But again, thank you so much. I am excited to share with you about this project that I was involved in the last 2 years. And I'm going to give you a little bit of background about the project and how it started, and have time for questions at the end. So let's get going. Before I do that, I definitely want to acknowledge where I'm presenting from. I am currently in the state of Kansas, and as you can see, I want to acknowledge different tribes that have been in this place. And of course, I definitely need to acknowledge that with this project could not have been possible without the financial support and other resources that we were able to use from the National Library of Medicine, and also from the All of Us project. Here I just listed a bit of the abstract for the presentation itself. You probably saw it as there was a promotion for this presentation, so I just wanted to put it there again for you to see it and see one of the things that I'm going to be talking about. And here's the outline of what I'm going to be talking about to you today. Like I said, we started by trying to examine the health information needs of the Latinx community, specifically here in Kansas, but we know that a lot of the times it's in the whole country itself. And then give you a background of the project, how it started, how Mariana and I met and brainstormed ideas, the topics that were included for this podcast that has been created, how we promoted the podcast in terms of social media, getting partnerships with other organizations, some of the things that we learned about this project, especially since we started the project before COVID-19 happened, and how we had to change gears and move in a different direction and approach to doing the recordings of the podcasts, and with some conclusions of what we, some data that we gathered and we're still gathering, and next steps of how we've continued this project after the funding ended. So I always like to start with this because it's really important to keep in mind how health literacy is a big, it's a very important topic to think about when it comes to every population, and in this case, of course, the Latinx community. And as you can see, health literacy is a social determinant of health. And of all those people that do a lot of work with public health, people that do work with the populations, you know that makes a big difference in how people, the decisions that they make when it comes to their health. And a lot of the times this affects also access to healthcare, access to primary care. And so all of this plays a big role in the decisions that people make when it comes to their health. So this is really important to keep in mind too, as we're trying to see, especially now with COVID-19 and the misinformation out there and the mistrust when it comes to the Latinx community. And one of the reasons what that is happening is, first of all, there's a lot of language barriers. A lot of the information out there is in English. And to think about and adding more layers to that is also that in the Latinx community, you have the majority speaking Spanish, But then you also see these other groups of people coming from other Latin American countries that speak the other dialects. Just thinking about the country where my family is from, Guatemala, there's 23 dialects that the Mayan community speak, and so you never think about this communities that come to the United States that they have their own native dialect that they speak, and then their second language is Spanish, and then they come here to a country that speaks English. So you see all these layers about that, and so there's that language barrier that creates mistrust. And then of course now you see with the shortage of Spanish-speaking healthcare providers, there's not that many of them that can provide those services in Spanish. And a lot of the times when there's organizations that check facts for information that it's out there that is wrong, they do it. But a lot of the times when they do the fact checking, they do it in English, and there's not that extra step to then put that information in Spanish. And so you see all of this happening that creates this. There's all this misinformation and confusion in what's out there in different topics. And so there's some mistrust in what's out there because people really know what to believe. And of course, we know that when they do go to a lot of this healthcare provider services, a lot of the times they don't receive as much of a good service as whites do. And a lot of the times too is because of this misinformation, these barriers to languages and all of these resources that they don't have access to. A lot of times they rely on family and friends, which could be a good thing because you trust those people, but also a bad thing because a lot of that those people that you're talking to don't have the correct information. And I say that because this is an example that I've been using since I've been talking about this topic. You go to a family member and you see what they say about something, and you talk, and then they give you advice. And this is an example of something that I read that somebody basically said, "Hey," she said, "Hey, they're relying on family and friends," and they said, for example, her parents suggested that she wouldn't have to quarantine if she drank homemade tea of lemon, honey, and ginger. And she had to tell her mom, "Hey, that's not true. And you're spreading this to other family members." And so that's the other thing of how that misinformation gets spread out. And so this is something to give you a little bit of background about what the research that we were doing for this project. And so we said, well, how can we reach out to this community and provide credible information? And something that it's going to where they are. And so we did a bit of research, and as you notice in this slide, it says Latinos use a lot of smartphones and internet. You see them, they have a lot of that's how they use the internet. Sometimes they don't have internet at home, but they have mobile devices where they communicate with family members, not just here in the United States, but in other countries. And so we figure, okay, this is a good statistics to know that they rely heavily on that. They communicate on WhatsApp with family members. I do that too. So this is a good way of saying, how can we reach this population in their mobile devices where they are located, and they don't have to go anywhere else, we go to them. So this is when I met Mariana, who's the director of Juntos, and I said, I worked in different projects with the National Library of Medicine. I got funding for projects that I worked in the University of Miami when I was in Florida, at UNC Chapel Hill when I was in North Carolina, and I really want to get involved with some of the projects that you're doing. The library could be a good partnerships to have. Health literacy is so important, and they're doing a lot of great work here in Kansas. And we start talking and saying, well, we would love to see if there's any funding opportunity out there that can fund this project. And that's when we started talking about, mobile devices, how can we reach the community? And they had already started with ideas of saying, we think that we could do maybe a podcast, but we need money to start that idea and create that project. And I said, that's a great idea. Let me put you in touch with John Brandwell, who was the head of the RML here in Salt Lake City, and let's set up a meeting. Let's talk to him, come up, share the idea. We want to collaborate, have the library be a partner, and go from there. And she was excited about that. And again, when it comes to partnerships, just making connections and reaching out and finding common ground and finding people that want to do great work for the community. Just having those conversations. We happen to run into each other on campus because I go into different meetings, and so that's how we met, set up this meeting, and started brainstorming about the idea about this project, what was different and unique. And so we found out that there was funding available that we could apply for, and this was a great idea. John said, "Oh, you know what? A podcast? I never even think about that. Why not?" And so we, got an application and applied for funding, and we're very fortunate that we got the funding for the project itself. And so we called it, Juntos por su Salud, Librarians and Health Professionals Empowering Latinos with Evidence-Based Health Information. And so we were fortunate to get this amount of money because we wanted to have staff, buy equipment and other resources that we needed to be able to create this project itself. So what was the idea? So the idea was, okay, why don't we reach to the Spanish-speaking population in their language? Let's take advantage of having healthcare providers that speak Spanish and actually have them talking to the community in their languages so they can hear them, trust them, because nothing has to be translated. They're talking to them directly in a casual manner, asking questions about a topic. And so we figured, how can we do this? We created the idea of Juntos Radio, and we wanted to have healthcare providers doing presentations, talking about health topics, but also not just having them say something about a topic, but having the library as a partner and the librarian providing supplementary resources in Spanish. And this is when we had a lot of the National Library of Medicine resources such as MLIS, and saying, okay, if we talk about specific health topic, let's have that conversation about the topic, and then provide supplementary resources such as MLIS, and say, here's additional information where you can go and learn more about this topic as part of this recording for this topic itself. And so that's how we ended up being able to have the healthcare provider talk about it and have resources supplementing that, because we wanted to make sure that they knew that this is also evidence-based health information. They're experts, but there's also other information they can use on the web, since they use mobile devices, that is credible and with information they can understand. And so we created the Juntos Radio. And so what did we do? Again, we wanted to make sure that we were doing our background information and checking out what's out there. And so we know that they were using a lot of mobile devices, and a lot of these people use social media. And so we didn't say, okay, what platforms would be useful for this, and be able to use in their smartphones. And we noticed, of course, people use Facebook, YouTube, and so we decided to create something that it could be more useful in more than one platform, so that it wouldn't be just in one place, but it wanted to reach people in different formats, in different places. And so based on that, we developed the identity. And we say the identity again because we wanted to say, okay, here's Juntos Radio, and we say Salud sin filtro, sin filters, so health without filters, because we want to make sure that, hey, this is open, it's a conversation, it's a casual conversation about health topics. And so we wanted to do this recording and say it's going to be in Spanish. And we want to have a target audience, just to you keep that in mind, and that's going to be a family member, and have create an avatar of some sort, of something that is more familiar, more credible, and then to develop this brand. We know that the organization is called Juntos. Let's keep that branding and just add radio to it, and then be able to feature, like I mentioned earlier, Spanish-speaking healthcare providers being interviewed and providing supplementary information in plain Spanish. And that way they could be able to follow up with that information, and be able to promote it out there in different platforms, based on the fact that a lot of us, including myself, listen to podcasts, not just through that specific application, but sometimes you look at YouTube videos, Facebook, even Instagram, and even got involved through WhatsApp. And so this was the idea, and we did a brief pilot testing with some community groups here in the area, and we had a positive feedback, and we said, okay, it looks like we're in the right track. They would be willing to listen to this type of programming in Spanish, and it would be accessible to them and user-friendly, again, because we don't want it to be too complicated in terms of how can they download it into your phones, where can they find it. Something that could be easy to find, easy to promote, and easy to access. So what did we do? So this, as you can see from when we got the grant, it started in 2019, which we had any idea about COVID-19 happening the following year. So I believe we started brainstorming ideas in early 2019, applied for the grant in the spring. And so there's a lot of paperwork that goes through it, and we finally got the funding at the end of 2019. But here's what we were going to use we used the money for. We needed time for recording and editing, so we wanted those resources, some software to add Spanish captioning. We also used some of the money to buy equipment, as you can see, microphones, video cameras, editing software. We also had hired an editing staff to help us with that, and headphones. And as you can see from the first picture, some of those first episodes were actually recorded in person, because in that fall and early in 2020, we had met in person to record them because we had the resources and the equipment to do so. So those a couple of first episodes were done in person. But when COVID happened, all of that had to be put aside, because now we couldn't meet in person. We had to think of a different strategy and process. And so we were like, okay, let's do this differently. How can we do this? And so we switched to Zoom. And as you can see in the bottom, now we were using Zoom as a software, and we were able to edit those videos through Zoom. And then everybody had to use their own equipment at their own places, so we couldn't invite our healthcare providers into this studio that we created in the Junta's office. But we just had to do and say, hey, let's set up a time from your place and record through Zoom, and that's how we continue the setup of recordings when the pandemic hit. The episodes, we had been excited that we had an idea and topics of health topics that we wanted to have in the recording, diabetes, cholesterol. There were some of them that we had already done research on and said, okay, these are topics that are going to be important for the Latinx community. And then when COVID-19 happened, we switched gears again and said, okay, well, let's focus on a lot of this thing that is important for the community when it comes to COVID-19, based on the fact that there's so much misinformation. And so we ended up focusing a lot of the recordings in the spring of 2020 and that year on COVID-19. So this is some of the topics that we included in there. So we talked about clinical trials, myths about the vaccine, physical activities during lockdown. And so we wanted to make sure that this were the topics that were relevant to the community then and be able to record them. And so you can see that we definitely did that and had them be recorded. And as of now, I have the total of the topics. We've recorded 48 recordings in Podbean since March 2020, which is when we started posting them. And those 48 topics, as we have gone through the recordings, have to do with COVID-19, but also other topics that are relevant to the community. And we had people reach out to us and say, if you're doing a recording on this topic, I do research on this. Can I get invited to your podcast? And I would love to talk more about this topic that a lot of times is not spoken about. And so it's been really great to do that. So those were some of the topics that we focused on when it came to COVID-19 in 2020. And then, as you can see, I have pictures here. I was also one of the people included because they wanted to do a topic on health literacy as a whole. But then what we did is we were fortunate to have a lot of Spanish-speaking healthcare providers at the University of Kansas Medical Center. Some of them were actually PIs in a couple of clinical trials for COVID-19. So they came and talked to us about that. And so we were very fortunate to have access to those resources and be able to have them reach out to them. And they were really happy to record the episodes, but also some of them, when they were hearing it, just reach out to us and said, I would love to be part of that. Can we do a recording on this topic? So it's been really great to see the the excitement for the healthcare providers and being able to participate. So that was in 2020. In 2021, because of the new variant and new things that has happened, we updated some of those recordings, and so there's more information on the variant, vaccines for children, getting the booster, so people understand that. I know there was a big and there still is misunderstanding about the vaccine and pregnancy, so we ended up updating and putting something for that for the Spanish-speaking community and getting speakers to talk about that. And so it's been great to be able to have topics that are relevant to what's going on right now, and we've continued to do all of that virtually because we haven't been able to meet in person. And so throughout last year, we definitely updated some of those recordings and still have those from 2020. But then last year, we included more updates when it came to Omicron and all of those new information that people needed. And so how did we disseminate this information? Like I said, we wanted to be out there and available, so we basically have uploaded it to Podbean. It's even accessible to Spotify. We've had some of it, promoting it through WhatsApp with the links. Facebook, you can access the Juntos Radio through Apple Podcasts. YouTube, we have a channel where we actually post the recordings so people can see the recordings through that. Why not we put it in Instagram? And because there's a big network of community here in Kansas, we were able to have, I believe it was Mariana that went to Telemundo and did a little bit of a broadcast and advertisement about the recordings and the podcast. And then I have a screenshot and a picture on the right where that's one of our local newspapers, Dos Más Dos, Kansas City. And as you can see, it's a bilingual newspaper, and it was really cool to see that they actually promoted in the front of the page. They had a promotion of the radio and how we were reaching out to the community and educating them about healthcare issues. And so it was great to see going from doing stuff virtually online, but also reaching out to the community in print newspapers to promote the recordings of this podcasts. So this is some of the statistics that we had from that we have. I know that some of them have changed from last year based on the new variant. But as you can see, because we put them in different platforms, for example, in here, this one of the ones when I got this data, the development of the AstraZeneca was one of the ones that had higher viewing, I believe, because they wanted to know more about what was the steps of being created and the information needed for that. And as you can see, the other one that was the second highest viewed was the one about COVID-19, the coronavirus, and then the one about social distancing and physical activity. So as you can see, there has been interest in the topics and watching those videos that people want to be part of. Here's another one about Podbean. And the good thing about having them in different platforms, we learn is because it's reaching out different audiences, as you can see from the previous one, this in YouTube had more views for the one about the vaccine development. And then here in Podbean, it had more about the physical activity during lockdown. So it's interesting to see, excuse me, the different views and people's interest in the different platforms. And so we're really glad that we were able to put it in the different platforms for people to see. And then in the middle of this, we definitely did some, wanted to see what people thought about it and got their information. And so as you can see, when we did this, we got a lot of people said that they really liked it, and they it helped them a lot to gather that information, and they felt that it was reliable and very helpful. And so we know that they definitely the feedback we got from those people was very positive. And now, as you can see, when it comes to knowledge, she said 76% of those people said, I'm more knowledgeable about health, and I'm definitely interested in looking more into the other resources available on these topics. Now, the thing with this is we were able to get some feedback virtually. Again, our idea was get some focus groups in person, go to some community groups and meetings and show them the recordings, get some feedback in person. But now, because of COVID, a lot of this had to be done online. So we had to seek out volunteers to join Zoom focus groups or even phone calls so we can provide and be able to talk to them about that virtually. So that was a bit of a challenge to getting that feedback, because again, we couldn't gather a lot of people in one place. We had to seek out them and then have them join us virtually to provide that feedback. But from what we got so far, we've got definitely positive feedback on the podcast themselves. Lessons learned. Like I said, from the beginning, we thought it was going to be in person, and therefore we were going to have used all of this equipment. We used it for the beginning of the recordings, but when COVID happened, that changed, and so we definitely had to adapt to doing this virtually. And so things to keep in mind if you want to do something similar to this is being able to adapt to change. Thinking that it's going to be done one way, and then things completely change and go on a different route, and being able to just go with the flow and work with what you have. And definitely we were able to work with the people and it worked out having other resources such as Zoom to be able to use that. And we hope that some of the material that we we have, we can use it for other projects moving forward, because we definitely want to take advantage of those resources that we bought. I mentioned in my previous slide, conducting those focus groups. We had to do it virtually, so that was a bit of a challenge to getting people to participate and give us feedback on that. But we'd be grateful that the ones that we've done to give us feedback has been positive, so we know that it's getting out there, and it's spreading, and they really like what they're seeing and what they're learning from those topics. Something that we also learned was, at the beginning, we wanted to have long episodes, 1 hour long episodes, because there was so much information that we wanted to provide to the audience. But then when we did that pilot testing, we realized that that was too long. A lot of these people might be doing this, listen to this when they're driving or they're working or walking, and so they wanted something that was quick, that they could get information and then be done with, and then go to something else. And so instead of having those episodes be an hour or even half an hour long, a lot of the episodes tend to be 10 to 15 minutes, 15-minute episodes. And then if the topic is really important, that we feel like, okay, you know what, this has to be longer than 15 minutes, we broke it down in 2 episodes. So you have part 1 and part 2 of some of those topics, and you can see when you go to the links that that's what we did, because we wanted to continue the conversation on those topics, but we knew that people wanted shorter videos and episodes, so we did that. The other challenge was also knowing that a lot of the software out there, when it comes to doing transcribing, a lot of them is being done in English, so it took a little bit extra to do the transcribing for those episodes for all of them, because they're done in Spanish. So that was something that we learned early on, that it was going to take a little bit longer to do so. So that's something to keep in mind when it comes to doing the transcribing in Spanish. Next steps. Like I mentioned from the beginning, a lot of this has been done in Spanish, which is great, and it's reaching to the community. But we're trying to think of ways, how can we also be more culturally and linguistically inclusive? I know that when it comes to Spanish, people from different countries speak Spanish in different ways. It was interesting to see when we did the recordings early on, thinking about what we call something, because we wanted to be as uniform as possible. And if you work with the Spanish speaking communities, there's a lot of terminology that it could be different in the slangs. Like I mentioned, my family is from Guatemala, and there's things that we call that are completely different than people from Mexico or even some countries in South America. So trying to think of what would be a term that it would be understandable, especially with health care terminology, that it would be uniform and people from different countries would understand, and not just one country itself. So that's something to definitely keep in mind when you're doing something like this, because it's we think about Spanish, but in that Spanish there's other layers to keep in mind about. And then of course I mentioned dialects, thinking about a way of how can we reach this community that is also in need, and Spanish is not their first language, but it's actually their second language. So we're still trying to work that out, and finding ways of being able to reach that specific community. And then of course partnerships and collaborators is so important. There's the way that we've got more speakers to come into the recordings is because people have listened to it and they like what we've done, and so they reach out to their colleagues and say, hey, you got to join this, or your research is so important that people need to know about it in Spanish, come and participate. And so we've done that a lot, and being able to expand that collaboration. One of the people, the groups that we work in here in Kansas is the Kansas Hispanic and Latino American Affairs Commission, and we've done a lot of that moving forward with Facebook. We've done some live Facebook Live and collaboration with them, and even events for them when it comes to getting the vaccine, and groups where basically, hey, from other locations where they can get it for free and get get the vaccine, but also get free food that we've gotten donated. And so that's been a way of, with this project, promoting this the podcast themselves, but also finding partners to work with, creating events where they can go and get the vaccine or get more information, educated, and be able to find those collaborators. So that's been a great way of doing that. And then also there's always, we always can use funding for to make the project and improvements to it. So we'll continue to find funding for the project itself to continue doing it. And so, like I mentioned, we've after the funding ended, we've set up more Facebook Live events that get recorded and then put into the podcast, and have people come in and get invited to speak to that. And definitely continue to get more feedback in the focus groups and other type of surveys to make sure how can we make changes to this and make improvements as we continue to do this, because we don't want to stop doing that. Like I mentioned, we have 48 episodes and we want to keep doing more episodes, about COVID, but also other topics that are relevant to the community. And you'll see from when you go to the links, and I'll be happy to, I know that we can put the links to the different platforms. You'll see that it's not just about COVID-19, but it's other topics that are relevant to the community. And so we just keep adding more topics that people are interested in doing them. So it's really important for us to continue this and not just stop now and seeing other ways of reaching out to the community itself. And it's been great too, when I've done these presentations, people are listening to this and sharing their links with their colleagues. I know that I did a presentation and somebody reached out to me from North Carolina because they wanted to use this with the community there. Another colleague was in Pennsylvania and they did that. And I know that the RML, when it was in California, they spread out the word out there. And so a lot of this is also the word of mouth that we started this in Kansas, but there's a lot of people in need finding and can use this podcast and in their communities around the country. So we're really excited to spread the word and get more collaborators around the country itself. So like I mentioned, now what we've done is we moved to a lot of Facebook Live events. And so here's a couple of the things that we did in December, as you can see, and we call it Kansas Al Dia, so kind of keeping you update with new information and bringing experts that talk about things that are relevant. So in this case, the first one is about the vaccine for for children, and also the booster shot. So as you can see, we have it in Facebook Live, and we have healthcare providers talking about it. For example, we have someone from Children's Mercy Hospital, and then of course from the University of Kansas Medical Center. And so we get, and then we have here Dr. Mario Castro, who's one of the PIs in one of the clinical trials too, and on campus. And so again, we having people from the community and healthcare providers doing presentations and continuing to talk about this and inform them. So this is the way that we've continued this, doing it through Facebook Live. Here are some of the links, and I believe we can put them in the chat and I can share that with you. And here's another link that we did like a 30-second video to promote the podcast, and I'll be happy to share that with you. But before I I also have one that I can show you for you to briefly listen to. Something to keep in mind is, because I want people to know about this project, but also, hey, apply for funding. The funding is available for your project. There's funding available. Listen to the RML, their emails, reach out to them, and there's funding that they can fund for your project. So reach out to them and say, hey, this is the idea that I have. Is there any money available for you to fund this project? Just like we did here in Kansas. And they'll listen to you and they'll help you and provide assistance with the process itself. And the thing to keep in mind is, be creative. Definitely have partners and collaborators in mind, because the more people that you're working with together, the less work you have to do, because you have people and reaching out to the community. Also keep in mind using your own resources too. But thinking about the ideas you want to do is thinking outside the box. Don't think that it has to be a traditional project when it comes to outreach. Thinking that, hey, it could be anything that's going to improve healthcare in needed communities. And so it's the podcast. Think about it. Who would have thought that this was something that people would be interested in? And we're reaching so many people out there, and using this technology and using what we have and using what people are using to reach out to them. So definitely it's a good idea to think outside the box and be creative and reach out, and there's money available. Take advantage of that for sure. So before I do this, let me see if you can see my video. So just kind of show you a little bit of a video for you to see what it's like. Can you see YouTube? And I'm trying to see if you can see, or did it stop sharing? I'm trying to see. Let me do a little bit, stop sharing and starting again, because I know that I have to, when I do that, I need to share the sound. Okay, so here's YouTube. So here's, you should be able to see, and so I'm going to put play just so you can hear how we start the recordings.
Bienvenidos a Juntos Radio, el programa de salud sin filtros.
Esta es una producción en conjunto con la Biblioteca Nacional de Medicina y todos sus derechos están reservados. Yo soy Valeria y soy estudiante de Medicina en la Universidad Autónoma del Estado de Hidalgo y me encuentro realizando mi servicio social en Juntos.
Y yo soy Liana, investigadora en el Centro de Juntos en la Universidad de Kansas. En este episodio de hoy se trata sobre los estudios clínicos, ya que últimamente hay varios proyectos de investigación sobre COVID.
Es muy importante entender lo que significa participar como voluntario en un estudio clínico e investigación científica, y esperamos que con la información que compartiremos el día de hoy les ayude a tomar decisiones bien informadas.
Bueno, esto nos lleva a nuestro primer punto. Vale, ¿nos puedes contar qué es un estudio clínico?
Claro, un estudio clínico, también conocido como un ensayo clínico, es una investigación acerca de algún medicamento o tratamiento que se hace con seres humanos para saber si es seguro y eficaz. Además, por medio de estos estudios clínicos, los doctores pueden encontrar nuevas formas.
So that's just briefly for you to see how it is. On the right, you can see that we've had the different topics that, and some of them actually became longer because we needed to give them more information. But for the most part, we tried to keep them short, 10 to 15 minutes. But some of them, because the topics were so important, we had to keep them long to provide that information that they needed. And so, we have that information. We have the little brief information about the recording, and then this is when I mentioned that we, as the librarian, provided some of the resources that they can link to the videos that are relevant to the topic itself. And so this is what the Juntos project is about. I really hope that you take a look at those videos and the different platforms that we've used for that, and I'm excited that people are interested in this type of projects, and so please reach out if you have any questions. Here's my information, and there's also Mariana's information, and we can answer any questions you might have about the project. So thank you so much for listening about the project itself. So if there's any questions, I'm gonna stop here and see if anybody has any questions for me. Thank you.
Brenda, thank you so much for a wonderful presentation. So as we open it up for questions, first I wanted to start with a question of my own. It's often difficult to get feedback from participants. And so you mentioned that you had to move to virtual focus groups and surveys. Can you give us any advice or tips on how you did that?
I definitely know that we, incentives are always good. I know that we were able to provide, and I need to ask Mariana this because she was more involved with the focus group and reaching out to the people. But basically, we had incentives of, gift cards to some of the local restaurants, and we reached out to some of the organizations where we would have done this in person and said, do you have people that we can contact and they want to participate? And we had some flyers in those organizations, and then saying how this is the incentives that we can give those people if they could provide us 20 minutes, 30 minutes for us to get some feedback on the recordings that we had. So I think now that we're doing this virtually is still taking advantage, of those organizations you have partnerships with and collaborations. But then instead of saying, okay, we have to go and do that in person in those organizations, how can we reach out to them and they can promote it for us? But definitely, I feel like with in order for, because in this case, you don't go there, people are not already there, they have to reach out to you virtually. Having incentives is going to be a key for them to participate. And just being happy with, small numbers to begin with, because I know that we figured, well, if we're going to go to a meeting at the church, because some of the groups that we work with are local churches, there's going to be a lot of people in the church. Well, when we went virtually, we knew that instead of having 30 people, we're going to have 10. Definitely take advantage of those 10 people that are going to reach out and provide feedback, because it's better than not having anything.
Thank you very much for that.
Mm-hmm.
Okay, so we had another question in the chat from someone who says they've been working on something similar in their community, but there's been some pushback from their public relations department. and concerns about legal ramifications. Have you experienced any similar roadblocks?
Not that I know of. If that person can elaborate the legal aspects that they said, because for the most part, we basically saying we have people talking about the research that they're doing. So in a way, it makes it seem a lot of the healthcare providers that we got to come to the to Juntos Radio and share their research, they're providing information about research that they're doing already on campus. And so many of the projects that they were talking to us about when it came to clinical trials or the vaccine, it's projects that are publicly funded. And so they were not really trying to sell us anything or do anything of that sort. It was more like educating us and telling us what they were doing with that vaccine or that clinical trial, or telling us, giving us information about it, saying, why getting the vaccine was so important and giving us facts about that. So we haven't gotten any pushback in terms of that. I'm curious to see what type, if that person can elaborate more, what was the type of push-up that you got, because that's interesting to think about. That being, is it a reluctancy from the people participating, or is it from the institution?
Okay, I'll be on the lookout to see follow-up.
Yeah.
We've got a few more questions coming in, so
Yeah, no problem. But I will definitely,
those.
you know what? And I was gonna say, if you have my email, please follow up, because it'll be interesting to see, if you want more advice about how we've done it, and we can talk more to you, that we haven't gotten any pushback about that. We're just getting positive feedback of, hey, people want to talk about the research and educating the community. They're just giving them facts and information, not promoting or selling anything. So I don't, what would be, there's no, and or providing medical advice for that. Say it hasn't been that way. It's more like, okay, maybe there's, I think in one of the topics is about myth versus fact. And so here's the myth. Well, this is the fact that contradicts that myth, and here's the reasons why that myth is wrong. So that type of thing has happened, but has been nothing more complicated than that. So I think for the most part, we've just relied on, this is the information, these are the facts, here's the evidence that backs it up. This is the reason why you should take the vaccine, or this is the reason why we advise you to participate in clinical trials, but something to that effect, that we definitely kept it very fact related and not that stuff.
Okay, so we have another question of how have you maintained the program post-funding?
So as you saw, one of the things that we've done is we've done more through the Facebook Live. And so because it gets recorded, we're able to post it. And so we've done, for the most part, most recently, we haven't done much of as much editing as into the recordings, as much of, what, this is what we're doing. We're recording it and it's going to be posted live. So we haven't done as much of that more editing or going back to making any changes to the recordings. I know at the beginning, because we had a software and we had somebody helping us, we would go out there and, when you're recording and saying, oh, shoot, I made a mistake, let me record this again. So for the most part, have done more of a, okay, this is going live, we're recording it, and this is how we're posting it, because people are seeing us, we're doing it, and therefore we're just recording what just happened. So we definitely reduced that. We haven't done as much Zoom as you saw, because we're taking advantage of some of the social media live options, and so we've reduced that. Did we do some of that in that way? So those are some of the ways that we've done that. But I'll be happy to, I'll definitely go back to talk to Mariana and hear more about one of the new things that they've done after the funding ended. So that's a good question.
And I guess also, can you elaborate on how you promoted the podcast?
Yeah, like I mentioned before, so Mariana and Juntos already has a big partnership with a lot of local organizations and community and churches here in Kansas. And so that was one way of promoting it to the people here in Kansas themselves. I promoted it to a lot of my colleagues and librarians around the country, because I've been part of of MLA, the Medical Library Association, or the different chapters that I've been involved in. So I did that through my own librarians connections. Also, because this was funded by the National Library of Medicine and working with an RML, we were able to have posts, like I mentioned, in California. We had somebody, do a blog on it. I reach out to my friends in the other RMLs and say, hey, can you promote this? And word of mouth, when the different meetings with the RMLs have done, and reaching out and sharing those links in the recordings. presentations. I did a presentation last year with a health literacy organization. And so trying to reach out and do presentations and share this project to people that are interested in so they can promote it to their colleagues and their communities. So we definitely done a lot of that. And I can mention, you saw that we partner with some of the local like TVs like Telemundo, the local newspapers, and people that are attending this conference. Like right now I saw somebody said that they were from Peru. They learn about it and they spread it out to their community. So I think it's been great to be able to share this presentation to different groups. Like in this case, it could be librarians or people seeking out funding. When I did the health literacy project, there were people that do health literacy, public health, and they work with different communities. And so we're definitely, thinking outside the box and reaching out to people that work with Spanish-speaking populations in different ways, in different formats, when it comes to the hospital, community health workers, promotoras, any of those groups of people that can take advantage of this and share their recordings. And I see something there about an advisory board. Yes, Juntos has an advisory board from different local organizations and leaders. And so Mariana works very closely with them when it came to this project and how we were doing the outreach and the topics and the people that get involved. There was definitely an advisory board that took part in that.
And thank you. And I know you mentioned quite a few organizations that you've connected with. Have you thought about partnering with public library systems to get the word out and doing programs with them?
That's a good question. You know what? I've thought about it, but I'm trying to figure out ways to do that. I know that I presented on this project here locally with the Kansas Library Association I think in the fall of 2020. So there were a lot of people attending that were from local libraries, including public libraries. So I know that there was a big interest and I promoted to them, but that was as far as I did that. I haven't reached out more specifically to more of the public libraries, but I think that's a great idea to reach out to them, especially some of them that are in some of the rural areas here in Kansas. Do more of that specific outreach to them. That's a good idea.
Thank you. And then we have a question. Have you made opportunities available for community generated questions?
That's, I think now that as you can see from the beginning, it used to be something recorded and we just posted it. Now that we're doing more of the Facebook Live, there's more interaction with the community or people that are watching it live, and therefore they're posting questions and comments as they're seeing the recordings. And I think that has been a great way of being able to reach out to the people and having that interaction happening, because they're not just going to, Podbean, listening to the recording, and then it's after the fact they can really follow up with questions. I guess now that we do this live, there's been an opportunity for people to interact with people that are being interviewed and talking about a specific health issues. So I think that has been a good thing now, that because it's being done live, people have the opportunity more for an interaction, not just listening for that.
Okay, perfect. And we have another question. Is this something you do outside of your working hours? And if it is during working hours, how does the library or your boss support it with hours not directly involved with institutional library work?
Well, I use it as part of when I got into the project as part of my working hours, and I know that our library has not been as much involved when it comes to outreach for the most part. We've done a lot of local, more like campus focus outreach, working with with the we have 3 schools. We have nursing, health, professional and health and allied health, and then medicine, and then we were with the hospital. So when I started here, I've been here for 4 years. The focus has been, doing outreach more campus wide, not outside of campus. But one of the things that has helped is in the last 2 years, as the campus focused their strategic planning and moving forward and realizing that there's, we have a very diverse community out here in the Kansas City area. They focus a lot of doing more outreach and community engagement. And I think that helped the director of my library realize that now their priorities are not just in the campus itself, it's more to the community, improving health outcomes. And so because of that, and from the beginning when I started, I said, my interest has been also outreach and patient education. I've done those things in my previous jobs. At the beginning, I didn't do as much because I was focusing more on my focus was more working with the School of Nursing. But as that strategic planning changed and expanded to the community, I was able to say, hey, this is part of the priorities for the school. Can I do this and work on it in addition to what I'm doing? Because it's one of the things that I'm passionate about. And I think this is going to be great for the community itself, for the library, because now we're partnering with other campus organizations working together, and also the community because they're interested in that. And so that helped me get time from my own work to add to it. And I'm passionate about this, so I always try to find time to do it because I love working with the community and making changes and improving that. So it helped that it wasn't just, oh, I'm interested in it, I'm going to do it on the side. The campus is focusing on doing more of that outreach. And we also were fortunate that we have a librarian that's part of the RML on our library. And so working with her and knowing that she's doing some of that outreach too has helped to partner and work with her too in that sense. And I'm also involved with the diversity committee on campus, and they're doing one of the that is also doing outreach out there. And so it has helped me to put the library as part of a collaborator in our partnership, and things that before I started there, I didn't even think about including the library on projects like this. But now that I've done this, I've opened doors in places that now they start thinking about how the library can be part of this. I mean, because of this project, and Margie is in the call right now, the School of Medicine said, can you do something similar when it comes to misinformation and vaccines? Because we want to do something with the School of Medicine and the students, because we're noticing that there's also some misinformation and misunderstanding with some of the people here on campus when it comes to the vaccine. Can you do something like that? And so we're hoping to work on something for the campus that has to do with misinformation and in that sense with COVID-19. So as you can see, this thing that it was more project and community wide is now also being focused on the campus itself. I hope that answered your question. But yeah, I was able, I think because the hospital and the campus has been focusing on saying, you know what, let's focus on the community. That could be something that I can work on and I'm passionate about, and I've been advocating that I'm going to be part of, and I'm doing my work, and then I can also be able to do this.
Oh, that was excellent. I think that was a great question to finish on, because you can tell that you're very passionate about working with your community. So I want to thank you again for your wonderful presentation, and it was a pleasure to have you with us today.
Thank
and if
you.
there are any questions that you didn't get, please reach out to Brenda.
Yeah, and I see a lot of comments. If you don't mind sharing the chat, I would love to hear some of those questions. And please reach out to me. I see a lot of great ideas and feedback that I got. I definitely, want to continue the conversation, or finding ways of promoting this to other people, or, finding ways of, can this be taking a different approach when it comes to other types of outreach, other projects. We always are looking for collaborators, and definitely take advantage of your RML and the resources that are available to you for sure. This would not have been possible without that. So that was a good, we had that opportunity to do that. And thinking outside the box, always that idea, don't think any idea could start with a little, thinking, this is really going to work. Well, look what we're doing with this podcast and how many people is reaching out, and so definitely do that for sure.
Thank you.
Thanks for watching. This video was produced by the network of the National Library of Medicine. Select the circular channel icon to subscribe to our channel, or select a video thumbnail to watch another video from the channel.